there, welcome back. Today we are going to go through how to enter in pain medication with the use of pre and post analgesic checks. So as always, we go to our friend Charlie Brown, topic, physician orders, medications. Okay. So we see that we have our two orders that we've already put in here for the losartan and the lorazepam. As we know, when we start to enter in a medication order, we are going to start typing in that medication. In this case, we are going to type in some acetaminophen. And you can see all of the choices I have for acetaminophen here. Sorry, let me just get, so I can get my mouse moving again. So you can see all the choices I have for acetaminophen here. So we're going to scroll down, and you can actually also do this by space, and we know that we have 325 milligrams. Alright, so we're going to do a 325 milligram tablet. We're going to hit enter. As we can see now, we've got our drug, our strength, and our route. But we know that the doctor is going to order, well, if the doctor ordered 650, we know that we need to indicate this somehow. So we're going to go down here again to this dose ordered button, click that. We have milligrams here. Our dose ordered is 650 milligrams, so we type that in. We hit enter. Oh, not enter. We hit OK. And now we can see that we have 2 tablets / 650. So that is what our dose is ordered as. All right, so we've got our drug, our strength, our route, our dose. Now this is going to be a scheduled medication, so we are going to come over here to our scheduled meds and frequency. So we're going to be giving that medication BID. We're going to jump over here now to 0800, and we're going to come over here to AM pre-analgesic check and AM post-analgesic check. All right. And then we'll come down here to, where are you at, 1600 for our next dose. And we'll come over here to the PM pre-analgesic check and the PM post-analgesic check. Now we're going to come back here because we want to have the start date. So first date, we'll make that today, because even though we technically missed the 8 a.m. dose, we are able to give it at 4 o'clock, so we'll make that order start today. Okay. The doc has written it without a stop date, so we don't have to worry about filling anything with this. Come up here for indication. We wrote that Charlie Brown was complaining of pain all over, just generalized pain, and asked if we could get some Tylenol scheduled. So the doctor has scheduled that because we talked about pain in our facts. The doctor is scheduling that medication for pain. Or if pain is also an active diagnosis in Charlie's diagnosis list, we also can choose pain for that as well. So we hit OK, and now we have diagnosis for pain. All right. The next thing we need to do is put in our side effects. Whoops. So there are our side effects, and now we save. Hit this, hit OK. Now we come back again to our first column. We hit check mark. There's our Charlie Brown. He's a handsome gentleman there. So we've got our order for our Tylenol loaded in here. We have it at 8 a.m. AM pre, AM post, 1600, PM pre, PM post. But we want to make sure that it's loaded in properly. So again, we're going to go up to dates, and we're going to say yes, leave those blank. And then we're just going to push out our dates here for just a couple of days, just to make sure everything jives. hit OK, and we can see that starting tomorrow at 8 a.m. we'll be able to give that dose and do our pre and post analgesic check. And we can see that everything else flows nicely with this order. All right, so that is entering analgesic medication using the pre and post analgesic buttons to be able to capture that in RMR. All right, thanks for tuning in. Stay tuned because there'll be more. Goodbye.